Hi, this is Doug and Wendy Gabbert, certified health coaches here in the bottom right of your screen. And today I'm going to do a quick presentation on controlling diabetes. I've done this several times before, and they're quite a bit longer. So I'm going to speak fairly quick and try to get through this pretty quickly. So anyway, with that, I'll let Wendy step out of the picture here and I'll jump into it. All right. So anyway, as we all know, when it comes to our health goals, the truth really does matter. And with that, we combine the best of nutritional science, exercise science, medical science, and with that, then we get predictable transformation. The CDC, I know all of us have had quite a bit of interaction in looking at the CDC lately, thanks to the pandemic. But what they talk about with diabetes is risks. If you have type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. They don't know exactly why this happens, but there's many factors that contribute to that, including having pre-diabetes, which can be noted in your blood sugars, you're overweight, you're 45 years or older, that would include me and quite a few of you probably watching this, or you have a parent, brother, or sister with type 2 diabetes. Well, the current stats for the CDC show, and I just pulled this up, in fact, this month, they show that the total number of people that have a prevalence of obesity, which is a high rated factor, as you heard, for diabetes, is over 40%. And you can kind of see where the totals are laid out between different age groups from 20 and over, 20 to 39. You'll see that they're greater in terms of obesity as we get older, but really not that big of a difference in the overall percentage of people that are considered to be obese. And it goes across from men and women, not a major difference there either. One of the things that was interesting to note for me is in my past presentation I did back in 2016, I pulled the data from the CDC, and their data came up through 2015. And what you're going to note there is it was only at 30.5. It has increased dramatically in the last few years of statistics they've been pulling. As you can see, this is a quote directly from the CDC's current site, where it says the difference from 1999 to 2000 up through the change from 2017 through 2018, it has increased to 42.4%, with the severe obesity increase from 4.7 to 9.2. No wonder we have so many problems in America today with obesity and health-related issues. Diabetes, according to the Mayo Clinic, is referred to as a group of diseases that affect how your body uses blood sugar or glucose. And if you have diabetes, no matter what type, it means you have too much glucose in your blood, although the cause may differ. Too much glucose can lead to serious health problems, and type 2 diabetes makes up about 90% of the cases where obesity is thought to be the primary cause, which is probably why in our health coaching, we see so much rapid change to people in their diabetes once they start to lose weight. Well, let's talk a little bit about glucose and insulin. And the role of glucose, which is a sugar, is a source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, your food and your liver. Sugar is, and that's not eating liver, I know most of you will want to know. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Your liver stores and makes it. And when your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogens into glucose to keep your glucose level within a normal range. Glucose and insulin, when we look at the relation of insulin, the pancreas secretes insulin into the bloodstream, and the insulin enables the sugar to enter into your cells. Insulin also lowers the amount of sugar in your bloodstream, which is critical. And that's what's happening when your pancreas becomes diseased through either type 1, which is a whole different topic that we could talk about. We're focused today on type 2 diabetes, the most prevalent form. And so you need the insulin, and you need it also to meter the amount of glucose that's going into your blood sugars. Well, if you take a look at this is from Dr. A's Habits of Health. You'll hear me refer to that quite a bit. And this shows an example of the majority of Americans and what we would call the modern life disease path. What you're going to see there is, if you kind of follow through those blue lines that are going up and down, that's your blood glucose. If you follow the insulin, you note that's following slightly behind. And what you're seeing there is, in a normal American diet, maybe orange juice in the morning, a bagel, a hamburger later in the day, and a soft drink, candy bar, and then a big old meal at night, and we go to bed, right? So the problem is you're spiking that glucose way too high. And if you'll note, the insulin is not even keeping up with those spikes. And it creates all kinds of problems in our health, with diabetes type 2 being so predominant. This is what Dr. A calls the healthy path, and how you control your diet with food types, with smaller meals more often, various things like this, and the right choices. And you'll keep those glucose spikes from being so high. Your insulin also now will not be having to work so hard. Your pancreas doesn't have to work so hard to keep that those levels down in a healthy zone. Well, I took a look at the Mayo Clinic, and they make some recommendations. We'll focus here on about 3 of those. Make a commitment to managing your diabetes, choose healthy foods, maintain a healthy weight, and make physical exercise a part of your daily routine. We'll talk a little bit more about each of those. And please note, what we'll cover today is going pretty quick, but in some of our other segments, we will cover quite a bit more of these details in a deeper dive. So first off, making a commitment to manage your diabetes. And why do we want to do that? Well, it lists here quite a few of the underlying causes that happen with diabetes. And I've coached many people, probably into the neighborhood of 30 to 40 people, either through the path of weight loss. Many of them got off medication or greatly reduced it. And all of the things that they talk about here are things that are impacts and a major reason to control diabetes. Taking a look at B, as the Mayo Clinic talked about, choosing healthy foods, they recommend eating lower glycemic foods. American Diabetes Association defines the glycemic index as a measure of how carbohydrates containing food raises blood sugar. And eat lower fat foods, use portion control, and have smaller meals more frequently. These are all things that will really help with your diabetes, or with also weight control. I wanted to point this out from Dr. A's Habits of Health. He suggests, and this makes so much sense, we've been doing this now, Wendy and I have ourselves, and coaching our clients to use a 9-inch plate instead of a bigger plate. If you noted, some of you that'd be at the age, if you went back, let's say into the 70s or before, plates were not super large. Well, they've gotten bigger and bigger because, let's face it, we eat bigger portion sizes today, but you want to break it down to that 9-inch plate. The other thing in learning how to control this is to recognize that the food we eat, the choices we make, is really enemy number 1 to diabetes, and that is throughout the stores. So you want to learn to shop healthy. I think one of the coaches will cover that in another segment, so I won't steal their thunder, but there are definitely some strategies on shopping and doing so in a way that is going to help you to have a better form of weight control, and also controlling your blood sugars. A couple of examples from the Habits of Health is to choose low GI vegetables, low glycemic vegetables. You'll see here, I won't go into detail, but in the green, they have a GI of 15 or less. You can see some there. 20 or more, and then you'll see those that are the higher glycemic form. And there's one in there. I know that Wendy would raise her hand and be very glad it's there. Don't want to eat peas. She doesn't like peas. I happen to like them. But anyway, eat those in moderation, or in particular, if you have diabetes or high blood sugar, then definitely lean towards those in those lower categories. Another thing is, we over protein it in our meals. You don't need a 12-ounce, 16-ounce steak. What we should really be looking at, if you're thinking visual, is more in the size of a deck of cards. And I'll show some examples of some meats that you can go a little bit larger portion size of in the next screen. So if you look at healthy meat choices, choosing the lower fat content, you'll notice that game, for you hunters out there, is one of the leanest sources that you can have. Pork loin actually is pretty lean. And then you'll see as you come right on down to the bottom here with sausage, where that's at, super, super high fat. I believe that's about where you'll find hot dogs as well in that category. And if you're looking at something such as a filet mignon, is kind of in that middle scope area. Then when it comes to putting a meal together, I just want to show this chart. One of the things that the health coaching and health coaches will provide and guide people through, especially when they're on program, and then you'll learn these things as well later, is the portion sizes you want depending on the carbohydrate levels of the foods that make up what we would call a lean and green meal. You'll see those recipes posted quite a bit. Again, there'll be quite a bit more details on that, some of the other segments that we'll cover. And the other thing to note is you can cook healthy and make it absolutely spectacular. I've had all of these that are shown here, both of these that are shown, absolutely fantastic. So you can eat super well and also eat in what we'll call lean and green style. We also will talk quite a bit about a 5-in-1 plan. There's also 4-in-2s. There's other plans that we cover that what that refers to is 1 lean and green meal, 5 portion control meal replacements or fuelings that we'll call them. And there's many choices that you can make that are healthy in there. The reason I also wanted to discuss the Optavia fuelings, not only do we use those in the weight loss stage, but we also use them in maintenance. And if you're looking to control diabetes, these are a low glycemic, healthy choice to eat. And so many of the clients that I've had that have lost 40, 60 pounds, somewhere in that range, or some more, some less, but they brought their diabetes numbers down. Many cases, all cases, reduced their medication or gotten off, is they use these fuelings 2-3 times a day to supplement their food choices, and also to get there and keep their diabetes in order. One of the things to note too is in our health coaching, you'll see where I put the stars here. There's an actual plan that's recommended for those that are on diabetes. So if you do have diabetes and you're considering losing weight, I highly recommend connecting to one of the health coaches. Then we will send a doctor letter, recommend you talk to your doctor, get some guidance, and we'll start you out in parallel with that. So just a sidebar on that. Well, point D was make physical activity part of your daily routine. And exercise is very important. I work at health clubs, at Cascade Athletic Clubs. So of course it's very important. It's been a very big staple to Wendy's in my life, many of yours as well. And what you'll note though, is in weight loss, it's only it's basically 80% nutrition and 20% exercise. One of the next segments that we'll be covering, or that I'll actually give an overview on, is what we call Dr. A's Habits of Health: NEAT, non-exercise activity, thermogenesis, you don't have to focus on the T too much, and exercise activity, and how to make those a part of your life for health and controlling weight and controlling diabetes as well. So just kind of bringing a few things into conclusion, because I got to keep this short, is if you focus on diet, you have some challenges. It's mentally, you're focused on food is the enemy, my bad habits, things I'm doing temporarily, and so on and so forth. And we all know diets don't work. So if you do focus on health, mentally focus on food as fuel, your good habits, things I'm doing, things that I want for myself, those kind of things in your health, those are the things that will drive the change. Just wanted to show one example. We've got many of clients that we've worked with who have lost weight and gotten their diabetes under control. This is one showing Jessica Ward with one of the Cascade clients, James, who was diabetic. That was one of his main concerns. He lost weight and he also dropped the diabetes medications. Now, we make no claims that that's what's going to happen, but we do make claims that when you are losing weight and eating healthy, you're definitely going to have a huge impact on your diabetes. So with that, I want to conclude with diabetes. It's important to, number one, learn the truth, choose health, make a plan, and then I also recommend get a coach, get somebody to help you through it. Thank you very much. Have a great day.